medicine on some level is so fragmented. Without technology, right? You go see one doctor, he repeats the
Right.
same tests as your last doctor. Go to the hospital, they don't know what your doctor did. And so obviously the fragmentation is like begging for technology, right? But the problem really is, you know, how technology is deployed becomes the issue. Because look, if Amazon can figure it out, right? And they're not like such a huge percentage GDP like healthcare is, right? But they have access to like anything. Like on your phone,
Right.
you could order, a new sweater and it'll be there the next day. Uh, that's not how healthcare works right
Right.
now. I mean, I'm still surprised how many people walk into a doctor's office and they're given a clipboard. I mean,
Right.
that's like that screams to anybody like, or if you try to call your doctor's offices and they say press one for this, press two for that. Really, that's really what it is. So obviously we have room, but
Room
the
to
problem
grow.
is I think yeah we have room to grow, but a lot of room to grow.
My podcast interview today is with Dr. Jonathan Baktari, founder and CEO of E7 Health and U.S. Drug Testing Centers. E7 Health offers a software solution for many drug testing labs throughout the United States, and U.S. Drug Testing Centers offers adult vaccine solutions. Dr. Baktari and I discuss how his company was already prepared for adult vaccinations to address the COVID-19 pandemic, and how digital health and implementing technologies such as AI is the future of healthcare, no matter how long it takes for us to get there. So, Jonathan, welcome to the Providers, Properties, and Performance podcast.
Well, thank you for having me. It's a big honor.
So I want to start with getting some background questions out of the way about, so we can dive into your expertise. You're the founder and CEO of U.S. Drug Test Centers
And
and
E7 Health.
E7 Health.
Yes,
And
both of them. Yeah.
how did you move from being an internal medicine and pulmonary medicine physician and specializing in vaccines and virus testing to drug testing in the vaccine
Right.
space?
Well, so no, initially I was just, I was went to normal training, residency, fellowship, practice clinical medicine. Subsequently, started teaching in med schools as assistant clinical professor, as well as the clinical practice. But then slowly administrative positions opened up that seemed interesting. And so, I was chief of medicine for one of the hospitals. I was medical director of an ICU, and then other positions opened up in hospital administration, insurance company administration. And so one door opened another. And so I eventually got to the point where, we had this opportunity to open up E7 Health, which we did in 2009. Subsequently, we spun off U.S. Drug Test Centers as a sister company to E7 Health that just does one of the many things E7 does. So, and then, we sort of built technology for both companies. So in many ways, we're a technology company masquerading as healthcare companies, because our goal is to leverage technology to reduce friction for patients, for the staff, and that's what we've been working on. And we want to eventually scale it and do it more regionally and beyond.
So what does E7 Health do? And then you can then tell us
Right.
what,
So
just obviously the
yeah.
testing is pretty
Yeah.
self-explanatory.
E7 Health was actually, we were originally called the Vaccine Center from 2009 to 2017, where we did adult vaccinations only, meaning we didn't do primary care, we didn't do urgent care. If you came to see us with a migraine, we wouldn't see you, we'd refer you. And because, I think people don't know, but even per the CDC, there's about 50,000 vaccine preventable deaths in the United States annually. That's almost the same number of people that died in Vietnam on an annual basis. So we really saw an opportunity for adult vaccinations. And whether it's in travel medicine, employee health, student health, there's multiple areas in healthcare that involve adult vaccinations that nobody was really addressing. People are doing it as a sort of like a side thing to their urgent care or their side thing to whatever else they were doing, but nobody was focusing on that as a space. So we made it a space, and then we started providing every service around the vaccine. So if you were traveling, we gave you, yes, the travel vaccines, but we also did counseling. We also gave you malaria prescriptions and other prescriptions. If you were going to nursing school and you needed vaccines, we also did the blood testing, the titers, we did the physical. So we started providing all the services around the vaccines. And that's why we eventually changed our name, because we got pigeonholed and they thought all we did was adult vaccines, which is true. We provide every adult vaccine available in the United States. But we also provide everything around the vaccine that you're going to need for employee health, student health, travel medicine. So we sort of evolved into almost, I think we talked about it before the show, a COVID company before COVID hit. That's what we were doing. We were giving adult vaccinations, and we were testing for, measles, mumps, rubella, chickenpox. We were testing for viruses, so you didn't have to get the vaccine if you didn't need it. So we were doing the testing, and so when COVID hit, it was like another, virus to add to our menu of what we were doing. So it was a lot of people pivoted to COVID, and we were going to get in the COVID business. We were already in that business, and so luckily my staff, and I have an amazing staff, was geared up for it in a really positive way.
Well, you have so US drug testing centers, what portion of eHealth that's just the
Right.
testing centers?
Right. Yeah. So if you really want to dissect it, E7 Health, we have a drug testing division that supports student health, employee health, because employees come and they need a vaccine, but they also are going to need a physical and a drug test. Right. So if you're starting a new job, you might get all of that. So we set up a drug testing division, and we wrote software and technology for it. And we said, oh my gosh, we could actually leverage this technology nationwide, because we can use other people's network to get the drug test, and our technology will drive it. So any employer, for example, could log on to our system once they are a client, and they can send 20,000 potential employees to 20,000 locations on the same day. Okay. And literally have the people just walk in with a donor pass that we create for them, get their drug test, and all 20,000 drug tests would come back to their dashboard the next morning if it was negative. And we would send them one bill. So that was the concept, allowing people to literally, for their employers, for other reasons, to be OSHA compliant. There are many reasons why people need drug testing, to allow them to do it nationwide, but have one account and get the results in one place, and pay only one person. In the old days, if you had 5 offices, you set up 5 different accounts, 5 different places.
Yeah.
Especially for a small to medium-sized company, it would be a struggle. So I think we're a technology company, so we write software and technology to address it. So all our clients, they are on our own proprietary software for the most part. So and the goal is to reduce friction for them, and as well as our staff.
And then your testing company has 20,000 testing sites across the 50 states.
Yeah, if you include all of them, we have all the LabCorp, Quest, we contract, meaning they're connected to our software. Third parties, I mean, you name it. If you go on that website, I don't know the exact number, but it is humongous, yes. And that is the whole idea, that you don't have to sign up with this company or that company. You can use our technology. We're sort of agnostic, and you can go anywhere, but you don't have to interact with them, set up an account with them. You don't have to, even book an appointment with them. We handle everything, and then you just get back to what you do, what your company does, and we become a drug testing solution as opposed to just a provider of a commodity.
And so do you perform the actual tests or just the software?
Well, I mean, on the E7 side, we do drug testing where we actually collect the samples, but on the US Drug Test Center side, since we're sending them, but most of our clients are out of state for where we are from our court. So yeah, so they're going to our partner laboratories to get it collected.
But you are but you do have some brick and mortar sites, and you mentioned before the show that you just purchased a property right next to a hospital.
Right. So we have US Drug Test Center's corporate headquarters there. So but we don't actually do drug testing there, but that's where the sort of the brains of it are, and the amazing staff. And then then we opened up an E7 office there, and it's in a medical corridor, few blocks from one of the bigger hospitals. Yes.
And was the intention to be next to a hospital so you could be, in kind of a healthcare corridor?
Yeah, I mean, a lot of the services we provide are, when we talk about employee health, there's many types of sectors, but the healthcare sector needs employee health services just because, hospitals have employee health departments, but for every one hospital, there's nursing homes, surgery centers, the companies that don't have the bandwidth to have their own employee health department. So we become the outsourced employee health department for healthcare companies, as well as defense firms, government agencies, cities, water departments. I mean, you name it, there's almost nobody that wouldn't need our services. But yeah, and also we thought it was a really strategic investment. All medical buildings tend to, in terms of their value, tend to appreciate. So it was an empty building, and to be able to fill it up with only medical uses, we thought it was a good investment for the company too. We needed space anyway.
Right.
Right. And so if we take some space, and then we have other people who also take space, and it's all medical, we thought long term, why rent when you can,
buy
buy it? And if you're going to buy and you're in the healthcare sector anyway, why not buy a medical building in a medical corridor and fill it up with medical tenants?
Makes sense to me.
But I think this resonates to probably a lot more to you than some people that might be listening. But
yeah, no, that makes sense all day long. So I want to move on to the COVID-19, and you mentioned that your company was already a COVID company before COVID, but that you were an expert on it, before it existed. And can you touch on that for me?
Well, only in the sense that I mean, when people think of COVID, they think of vaccines and testing for viruses, and we were already doing that for. We were giving out the rabies vaccine, yellow fever vaccine, Japanese encephalitis vaccine, meningitis vaccine, shingles vaccines. These are all adult vaccines generally. Up to you need a tetanus shot, a booster every 5 to 10 years, pneumonia shots, flu shots. So these are all, people think vaccines and they think children, but really there's a whole gamut of adult vaccines that people now may realize it because of COVID. But we were in the adult vaccine kind of spectrum before it hit. So we understood, what it meant to how important adult vaccinations were for adults, as well as testing for it. And our software was geared up for it. I mean, it was our processes. We have a vaccine refrigerator. I mean, most doctors have like a refrigerator from Home Depot that they have. We actually have a massive vaccine refrigerator, which keeps all the vaccines at equal temperature. We have processes. We monitor expiration dates, and we have training on how to give the vaccines for our staff. So that's all we were doing from 2009 to 2019 when the pandemic hit. So it wasn't a stretch to like understand, what the SARS-CoV-2 virus was and the direction it was going to go.
So for COVID, you were already set up with people, systems, the technology and the infrastructure to deploy the adult vaccines.
Well, yeah, I mean, initially, we didn't, obviously the vaccine was managed by the government, so we didn't have, it wasn't commercially available, so we couldn't necessarily get it. But so what we focused on is we rolled out the antibody test very early. We were one of the few people that rolled out very early in the pandemic home saliva, where you spit into a little tube, home saliva or work saliva testing that we would ship to you. You'd FedEx it back, and you'd go on our portal. And so we had that portal technology. You could order it up on our website, online. We integrated it, and automatically would be FedEx to you, and the results would then go onto your portal. So once you created an account, the results would be there. All of that was sort of pre-existing our online portal and all that. And so, yeah, so it was a lot of, I know my staff, for the first couple of months when the pandemic hit, we were all working really hard, but we weren't starting from scratch.
Right.
We weren't like doing Botox and now we're doing COVID testing, right? Which is, you'll say, oh, that used to be a Botox, and now they're doing COVID testing. And so for us, this is what we did.
So, what do you think we learned from COVID, and what do you think we'll be better prepared to do for the next pandemic?
Yeah, actually, I did an op-ed piece on this, and I think in the Toronto Sun. But yeah, preparing for the next pandemic is honestly realizing that how pandemics really, start. Pandemics tend to really start often if you really kind of look at the more common pandemics, and animal transmission to humans. I mean, whether MERS, SARS, all of them have the sort of like background, and whether this came out of a lab in China or out of a bat or some market, it's still the same thing. We're talking about an animal virus that somehow crosses over. So it's clear that those are we just have to understand that when we interact with wildlife and when we interact with different scenarios, that's going to increase the likelihood of transmission in another pandemic. So I think, it's a very tough question to answer, but I mean, even deforestation, where animals become in closer contact with humans, and, all of these things that allow, more human interaction with, animals, bats, what have you, they all increase the chances of pandemic. So there's something to be learned here, about, and also on the flip side is preparedness. I think just the lack of masks, the lack of this and the lack of that. It's, you would think, we would learn from that and understand that better. And also, I think, learning to follow the science and not being, not just following anecdotes about what the right thing to do, to be a little more patient, do double-blind randomized studies on things, as opposed to, hey, this worked on 2 people over here, so right. So my favorite line that I learned in medical school that I repeat is, the plural of anecdotes is not data. So it's tried and true. So I think those are, to answer your question, those are the broad things we can learn.
Yeah. And I think as long as we continue to travel like we do as well, I mean, people move all over the globe, I think faster than any other time. So let's go to digital health, because you guys are obviously a technology company. So why is digital health the future of healthcare?
Well, it's the future of healthcare because medicine on some level is so fragmented. Without technology, right? You go see one doctor, repeats the same tests as your last doctor. Go to the hospital, they don't know what your doctor did. And so obviously the fragmentation is like begging for technology, right? But the problem really is, how technology is deployed becomes the issue. Because look, if Amazon can figure it out, right? and they're not like such a huge percentage GDP like healthcare is, right? But they have access to like anything. Like on your phone, you could order a new sweater and it'll be there the next day. That's not how healthcare works right now. I mean, I'm still surprised how many people walk into a doctor's office and they're given a clipboard. I mean, that's like, that screams to anybody like, or if you try to call your doctor's offices and they say, press 1 for this, press 2 for that. Really? That's really what it is. So obviously we have room. But the problem
grow.
is, I think, we have room to grow, but a lot of room to grow. But but digital healthcare has too many. I think it has too many masters. They're trying to please Medicare, and they're trying to please Obamacare, and they're trying to please Blue Cross and Cigna, and they're trying to maximize reimbursements. And by the way, we're also trying to make the patient's life easier. And by the way, we're trying to maybe make the provider's life easier. The interaction between Amazon and you does not involve any third parties.
Right.
And so it's easier to drive technology when you only have 2 people sitting at a table. If there's 6 people sitting at a table and you're trying to drive technology, and each one has a different set of interests, not even necessarily conflicting, but a set of interests. Who are you writing this technology for? Right. Are you
and who's liable for the security?
There you go. On top of that. Yeah. So I think there lies the challenge in digital healthcare, because if it was as easy as just making the doctor and patient happy, you'd never need to call your doctor or hospital to get your medical records or refill your prescription, or find out what's covered and what's not covered on your or how many times have you showed up in a pharmacy and say, oh, by the way, that's not covered? You're like, well, there's got to be a better way for me to know that, than me show up, wait 45 minutes and then find out it's not covered. So at least this is what my patients tell me. And so I think digital healthcare is the future, but we have to figure out what the priorities are. You give a software engineer a top 1 priority, they usually get it right. Okay, but you give a software engineer, okay, these are the top 4 priorities. Well, I mean, we write software, so at a point you're writing the code, right? And you get a fork in the road. This is going to increase reimbursement, but make the patient's life a little more difficult. Or this is going to make the patient's life a little easier, but the reimbursement might drop because of this, because whatever. And so they're just, when you're writing technology, you're like, at some point you just have to pick one or the other as the priority in that step. And so, it becomes, when you talk to people who write technology, you see that they work on priorities, like, what's the goal here? Is it user experience? Is it quality? Is it a combination? Or is it some other things besides user experience and quality that matters?
Yeah, and I wonder, putting the, starting with making it easy for the patient to navigate as a starting point. How can a patient open up their phone? Because it will happen at some point. Open up their phone. They need to, see this doctor, find out if they're in their insurance, what the copay is going to be for that physician, what, out of pocket, any out of pocket costs for whatever procedures. Just nothing's that transparent in healthcare. So it's going to be a long time to get there, but we can get that information usually for pretty much any other thing, but healthcare is still somewhat of an, I guess, inefficient market.
Well, yeah, I mean, Trisha, let me ask you a question. I mean, let me like ask you a question, turn the
Sure.
tables on you. If you were the head of a healthcare organization and I came up to you and I said, listen, I have this new technology that I want to sell you that is going to make your patients' lives 1,000 times easier. Okay, are you with me?
Yeah.
And they're gonna love it. They're gonna have access to everything, but your Medicare reimbursements will go down 10%.
Right.
Are
Right.
are you buying this software? Are
Right.
you buying this technology?
So, well, that's a question. I mean, so first, do you take Medicare? And if you do, then yes. But then also, will it affect other reimbursements? So you have to go
Right.
through and do all of that research, which
Right. No,
who has the
I use
time?
Medicare as an example, but let's
Right.
say globally, whoever you're using,
Right.
they'll go down 10%, but your patients' lives will be, and your provider's life will be easier.
Right.
And you're head of this organization. What do you say?
But wouldn't the insurance companies be incentivized with, you know, I guess making, I mean, they wouldn't have, if they could automate a lot of,
Mhm.
the questions that come into them for all of these
Mhm.
pre-authorizations, it would save them some on their end as well. But
Yeah, but
they're not there yet.
again, if I,
Then we'd have
I
less people to call at the insurance company and we'd
yeah,
absolutely get no
yeah,
information.
yeah. I, I guess someone who would be cynical would say you don't want to make authorization easier. You want it
To be
to
harder.
be. I mean, again, if I'm being cynical, I
Right.
mean, yes, I'm sure many insurance companies want to make and look at their software. They are improving, but is it really that straightforward? I don't know.
It's not. And I think the more walls they can put up and make people have to jump through, people be like, okay, I'm done doing this for today. All right, I'm done doing it. And then it just, they keep kicking the can down the road and the insurance company doesn't have to then pay for that procedure.
Right. I remember, I called then a prescription for one of my family members, and just a couple of weeks ago, and I went to pick it up, and it was just a very cheap antibiotic, and I went through the drive-through, and I'm like, yeah, so I'm here to pick this up because, oh, I don't know if it was CVS or Walgreens or, but one of it goes, oh, Walgreens, we're not in your plan. You got to go to CVS. I'm like, well, how much is it? Like, well, it's $20. You know what? Here's the $20. I mean, so you're like thinking, oh, I'm going to go and get the doctor to call, or I'm going to call it into this other place.
Right.
At a certain, like you were suggesting,
Yeah,
you get battle fatigue.
totally. Totally. So, okay, one last point and then or question, and then we'll go to the Q&A. But talk to me about using AI in drug testing software.
Yeah. So, um, our AI, just in general, and all our technology is more focused on quality and medical errors, as how we've rolled it out, and we use it both in drug testing and in E7 Health. The question really is, especially in medical errors. I don't know if you've seen the whole world of how many lives and how much damage medical errors, natural mistakes that happen in everything healthcare. The wrong prescription, I've heard people taking out the wrong kidney, the wrong this, the wrong that, or been given a medicine they're already allergic to, or whatever it be. So I think the easiest way for me, who lives and breathes quality, and it's a cultural thing that we have in our organization, quality. We have been focusing on leveraging technology to manage not only medical errors but also patient errors, like when they're supposed to come back, what is it they were supposed to get. We don't leave it up, we say, well, come back in 6 months and we'll give you this, and they kind of leave it up to the patient to make the appointment in
Right.
6 months and come back and say, remember you asked me to come back in 6 months for a mammogram. No, we don't do that. We schedule the mammogram, when you're there, or whatever it is, and you have the appointment, even if it's 6 months. Okay, and we don't like call us back and book an appointment for this or that, or and we just our technology and systems really anticipate errors. And in fact, we have things for our staff that if something is not right, they simply can't proceed to the next level. Let's just say a vaccine, our system indicates the vaccine they're about to give is expired, by an hour, a day. Usually we do it end of the day, but somehow, let's say it happens, our system just won't let the person move ahead.
Yeah.
You're like stuck.
Right.
And I think it's a form of AI which leverages technology to make sure that policies, procedures are built into the technology. And as you change, you have the flexibility of changing that. So you reduce medical errors, patient errors, as well as compliance. For example, when we give you something or we do something to you, we send like if we give you a vaccine, there's a whole sheet from the CDC we read to you that actually some places don't even do that, but we read it to you. But we also automatically gets pushed to your patient portal. So even when you go home, I mean, what do they say? What do they say I should be looking out for? And so like many places just use the patient portal to give you the results, but we also use it to ensure compliance, give you directions. So you can go on your phone and say, okay, how was it? How was I supposed to do that? And this is really a long-winded way of telling you that I think we can leverage technology in healthcare to manage, reduce all those three things, compliance, medical errors, and patient errors.
That's great. I find it amazing that you're right that some practices don't do the follow-up for like another appointment or procedure, but they know how to call, text, and email you several times before your appointment so you don't forget.
Right. Yeah. It's called like a no-show algorithm because they right, really, that's what it is. They're trying to prevent no-shows. So
yeah, exactly.
right.
Okay, so what was your first job?
Oh, you mean even before college? I mean, my first
It can
job?
be whatever, yeah. Whichever one.
So, I mean, I was a straight arrow. I went to college, med school, residency, fellowship, but I did, like in the summers when I was in college, I worked as an orderly in a hospital. In high school, worked at a restaurant, just doing menial stuff.
Yeah.
Yeah. So, even younger than that, shoveling snow in the winter for the neighbors and making money,
Yeah.
shoveling the driveway kind of thing. So, but yeah, once I got into college, it was like an express train and went right through it all.
Well, what do you think you'd be doing for a living if you were not in healthcare or went the path of a physician?
Okay. I think what I'm doing now, which is more the administrative entrepreneurship, being a mentor, focusing on leadership. I internally I give classes for my staff on everything from how to handle phone calls to how to mentor other people, what qualities to look for when you're hiring people, sort of almost like CEO kind of stuff. And I think now that I'm doing it, it kind of feels, it feels comfortable for me. I kind of feel like, so I think probably just, going that sort of administrative CEO route and helping build cultures, build other leaders, is a lot of fun for me.
Oh, I like that. Who are you reading or listening to right now for news, information, or inspiration?
Um, well, I've been reading a lot of business books because obviously, I'm technically in charge of our business growth. So I don't know if you've ever read Tribal Leadership, which is a really great book about how to improve culture in an organization where your success is measured by, I don't want to wrap up the book in one sentence, but your success is measured by how much you make other people succeed, not necessarily just you.
Yeah.
So I just read another book called Blue Ocean Strategies, which is a classic business book about how to grow your company in the direction where your competitors become irrelevant. You don't want to be just another person, just fighting for the same thing, but innovate in a way where you don't have competitors.
Right.
And so just off the top of my head, I wasn't prepared for that, but those are like a couple of things I've been looking at.
Oh, that's great. What is one thing you do every day for healthy self-care?
Yeah. So first of all, I really try to limit, and it's something I preach to my patients, limit carbs to avoid processed carbs and simple carbs. And, if you're going to have carbohydrates, just to have it in the good carbohydrates, as I always call them, with fiber and protein somehow wrapped into it. So that's it. And then to stay active, go to the gym at least 3 times a week, get your heart rate up, and also I think in terms of healthy living is just sometimes you have to turn it off and not be on 24/7. And actually, what I tell people is if you really are able to turn it off, sometimes the best ideas come to you when you're sitting on a beach somewhere, right? And so to be able to do that, to be able to turn it off, so you can get recharged.
Absolutely. Do you think a person is born with the desire to heal, or this is just learned through their medical training?
Well, I think when I started, I think a lot of people who went into healthcare felt that it was like almost like a calling that drove them. I think but when I started healthcare, like 75% of doctors went into private practice where they were their own boss.
Right.
If you're entering medical school right now, there's a 75% chance you're going to be working for someone.
Right.
And so I think that's changed the equation where people going to healthcare, if that's the point of your question, feel less and less that it's a calling and more that it's a job. And so, I mean, of course, there's exceptions, but I think as more and more providers and doctors work for someone else, as you could just imagine, like even in your field, when you're working for someone versus it's your own business, your own thing, sometimes your passion goes up when you own the thing. So do you own the hot dog stand or you work at the hot dog stand? I mean, it matters.
Right. Absolutely. Well, this has been a wonderful interview. I really appreciate your time.
My pleasure.